Regular doctor checkups have taken a backseat over the past few months, especially among men. As part of Men's Health Month, Dr. Brent Wallis from People's Health joins us now with why it's so important for men to stay on top of their health. Good morning, Dr. Wallis.
Good morning. Good to see you.
See you too. Okay, so what are some of the top health risks for men nowadays?
I think number one by far is heart disease. The American Heart Association says over half of men over the age of 50 have some form of heart disease. And another one is stroke. Over 80% of strokes can be prevented if you just go to the doctor. And then another one to really think about during this time too is depression and suicide. Suicide is actually the 10th leading cause of death, and a lot of men tend to not seek care for depression and suicidal thoughts.
Is that, you think, because they're worried about like stereotypes and just kind of being judged for seeking help?
Yeah, definitely. You know, men traditionally don't go to see the doctor. In fact, a lot of men don't even have a primary care physician that they see. So really there is a little bit of a stigma associated with it in their minds, and we really need to break down that stereotype.
I feel like we hear a lot about prostate cancer. Is that also pretty serious among men?
It is. Prostate cancer is the second leading cause of death. But what's interesting about prostate cancer is that it can be treated and often cured if caught early. So that's another reason why it's so important to go see your doctor and get checked.
Well, I know a lot of times, you know, somebody might say, I feel fine. Why do I need to go to the doctor for a checkup? I mean, I feel totally fine, but there could be underlying issues that they don't know about, right?
Definitely. In fact, there's a whole lot of diseases that don't cause any symptoms at all. Hypertension, for example, which is a form of heart disease, most often is completely silent, and most people don't have any symptoms at all. So if you don't go to the doctor to get a regular checkup, you may never know that you have it.
Gotcha. Now, a lot of people obviously are concerned about going to their doctor's offices because of the coronavirus. Should that still be a concern? What precautions are being taken at doctor's offices to keep people safe?
Yeah, it definitely shouldn't be a concern right now. You know, if any place is actually safer, it's your doctor's office. All of the local clinics and health systems have put in place really excellent protocols to reduce the risk of exposure to the disease. You also now have the option of telemedicine with your physician. So if you are really concerned about going out in public still, you still have the ability to connect with your doctor through that format as well.
Yeah, if you're really high risk, for example, and you just think, you know what, I cannot take the risk of going into a doctor's office, I guess even having that initial visit via telemedicine would be better than nothing.
Yeah, it's a great adjunct. It's a great tool that we have now, and I think going forward we'll see a lot more use of it. But it provides an additional touch point to your doctor that's so important.
Definitely. All right, Dr. Brent Wallis with People's Health, thank you for your time this morning.
Thank you. Have a good day.
You too.